Okay, so this video is going to be very different than anything else I've covered on my channel thus far, but I believe it is for a good purpose because last year on August, I believe it was 16th, my cat had a perineal urethrostomy, which is a procedure done on male cats who have frequent urine blocks, and it is where they remove their male parts and shorten and widen the urethra opening so that there's like less distance for the pee to go and it's wider so there's less possibility for blocks. So essentially they turn the male cat parts into mimicking female cat parts. My cat Dipper had this procedure last year around August 16th, and I documented his recovery on my TikTok. And to this day, I still get a ton of questions from people whose own cats are about to go through this surgery or who have gone through this surgery, and they just like have questions about the healing process, what it was like for Dipper, what to expect, that kind of stuff. So those always pop up on my TikTok videos, and sometimes I get direct messages. And because this was done on TikTok and I've made several updates throughout his journey and updates to answer some of those frequently asked questions in a like video format. Because that happened all like over the span of a year, those videos are now scattered throughout my TikTok. And so anyone who's looking for all of this information in one place is going to have a harder time finding it. So that's when I decided to take all of those videos and even some videos I never posted, compile them all together into this long YouTube video format. So this video is for people whose own cats are going to get a perineal urethrostomy or have gone through a perineal urethrostomy, or for people who are just curious what recovery is like for cats who've had major surgery. And before I continue, I need to give two disclaimers, one super massive disclaimer and then one like smaller disclaimer that like is not a super big deal breaker. But disclaimer number one is that I am not a veterinarian. I have zero education, training, or experience in animal medicine. So I am not here to give anyone at all, I'm not giving anyone medical advice for their pets. I am simply sharing my personal experience of having a cat go through this surgery and his recovery, and sharing things that I did, things that I thought worked, things that didn't work, things that my vet recommended. But at the end of the day, I am not a vet. My vet isn't the vet of your cat. So always, always, always talk to your vet about concerns that you have with your pet as they heal from the surgery. I had the benefit of being able to take Dipper in once a week for it's like 3 or 4 weeks after his surgery, for the vet to do like a free wellness checkup to make sure everything was healing properly and that there was no other complications with surgery. I don't know if every vet offers that. I would ask if your vet can offer that. But I also know that not every cat can handle the stress of going to the vet that frequently. I didn't think Dipper would be able to handle it, but he was so drugged out of his gosh dang mind that he didn't really care, I don't think. Usually he's a monster going to the vet and just in general. But yeah, so that is my massive disclaimer. Talk to your vet. I am not giving you advice. I am just sharing my own experience to hopefully shed some light on things that maybe you're confused or concerned about. But again, always talk to your vet. Okay, disclaimer number 2 is that, as I mentioned, I was documenting Dipper's journey on TikTok, which means the majority of the rest of this video is going to be vertical format. So I apologize in advance for that, and hopefully it is not too annoying. Okay, so first let me give you a little bit of background on Dipper's urine block history, I suppose. So I don't remember super well, but when he was around 2 or 3, he had a bit of a urine block scare where it looked like he was struggling to pee and was in pain. So I took him to a vet, and I don't believe he had any sort of surgery done. I think he wasn't blocked yet, so they just had me change his diet to like a prescription urine control diet, and then he was fine. That was so long ago that I can't remember the specifics, but I think I would have remembered if they took him in that day and removed the block. So that was just like a little scare. He had had no problems since. I started feeding him Hill's Science Diet, urine, and hairball control. So not the vet prescribed formula, but a similar formula that didn't need a vet prescription. There's a few different options that you can feed your cats. I'd obviously recommend talking to your vet about what will be best for your cat. He was fine for years. And then last year, I noticed that he was really lethargic and hiding a lot, like hiding under beds and couches and stuff, and didn't really want to move. And when he did move, he walked like an old man with like joint issues. Like he just couldn't, he just looked like he was like all hunched up and in pain. And I was like, okay, this isn't normal. Maybe he's just got an upset tummy. So I started with feeding him some canned pumpkin and emu oil, thinking that would loosen things up in his tummy and help him, like maybe he was a little bit constipated. I don't know how long I waited. I think I waited like an hour or two and like saw no change. I was like, okay, let me call the vet. Oh yeah, mind you, this was on a Sunday, which is why I didn't call the vet immediately, because my vet isn't open on Sundays. In fact, most vets are not open on Sundays. So I called a vet in town that was open, and I believe I kept getting their answering machine, because I ended up driving and going in person, so I must have kept getting answering machine and leaving a message and not hearing back. After leaving like 2 messages, I drove in and talked to someone at the front desk, explained the symptoms that my cat was displaying, and they were like, this sounds serious, but we are booked. Like, we are full. We are at capacity. We cannot take your cat in, but this sounds like a serious issue. You need to call the emergency vet. That sounds expensive, doesn't it? So after I talked with them, I called the emergency vet, and it's getting kind of late at this point. Like, the sun's starting to set. Called the emergency vet, explained to them Dipper's symptoms, and they were like, it sounds like he has a urine block. You need to bring him in as soon as humanly possible, or else he could pass away. So, went back home, got my cat. He was not happy about having to be put in his carrier, but he was also in a lot of pain, so he didn't fight very much like he normally does. Drove, I believe it's like 25 to 30 minutes to my nearest emergency vet. So drove to the emergency vet, gave them Dipper, and then waited to hear like what was up. I waited for a really long time, like surprisingly long time. And I'm like, what is going on? How long does it take to just feel if he has a block in his bladder? But they must have been probably busy. So finally someone comes out, takes me into a room and tells me that yes, he has a block. They can unblock him. Hopefully that solves the issue. But once a male cat gets one block, they are even more, so male cats in general are very likely to get urine blocks because of how small and long the urethra is. And so she told me that once they get blocked, they are so much more likely to get blocked again, because the scar tissue that builds up in the urethra, like, makes it even smaller of an opening for the pee to go through without any blocks. So she did warn me that this could be a persistent thing. What I did not expect was that persistence would be 3 weeks later. I will get to that. So they kept him for 3 days, I believe. I believe it was 3 days, and to monitor, to make sure that they were able to remove the block and there was no complications. 3 days at the emergency vet. That was a hefty bill. If I can find it, I will post it in this video. I'm gonna try to post all of the vet bills that I can find in relation to Dipper's procedure, just for like, this is how much stuff like this costs, okay? So then I pick him up, take him home, and he's fine. He's doing good. The thing I wasn't expecting actually was that my other cat, Padfoot, wasn't going to recognize him. I wasn't expecting that. They've lived together for like 5 years, and suddenly Padfoot's looking at Dipper like he's never seen this cat in his life, and I think it's because he smelled so different, and I wasn't expecting how long this was going to last. Like, Padfoot didn't trust Dipper for like at least a month, maybe 2, I can't remember, but it took a long while for Padfoot to get used to Dipper again. So that's something that I wasn't expecting, but it's very common that if you have other cats and your cat is going to be in the vet for like a long period of time, they're going to come back smelling different and your other cat may not recognize them for a bit. So yeah, that wasn't expecting that, but it is common. If you Google it, there's lots of people that talk about that happening. Is that your friend? Did you miss your friend? I can't take him out because he's got poo-poo butt. He's got poo-poo butt. Oh, was that Padfoot?
Yeah.
Oh. He's your friend. He's okay. All right, Dip Dip, we're home. We're home, baby boy. Hi. Oh, you did get poo-poo everywhere, didn't you? You have a little poo-poo accident? Yeah. Hey, how about we take this off first? Take your... Oh, don't wipe your poo-poo all over me. We'll take your bandage off, okay? Take your bandage off. Yeah. That's good, Dip Dip. Yeah, that's good, baby boy. That's Dip Dip. What's that? Padfoot, that's Dip Dip. That's Dip Dip. Padfoot is Dip Dip. That's Dip Dip. You know Dip Dip. Fast forward 3 weeks and Dipper is starting to display some of those initial symptoms that he displayed 3 weeks prior that led to me having to take him to the emergency vet. But thankfully, this time Dipper had the decency to have his issues on a weekday and not when my vet was closed. So I could take him to my normal vet and not the emergency vet. So like still expensive, but not as astronomically expensive. So I take him in and I say, I think he's blocked again. He was just blocked like literally 3 weeks ago, but he's acting like he's blocked again. So yeah, they take him in. Sure enough, he is blocked again, and that's when they tell me again the possibility of the more he gets blocked, the more scar tissue that builds up, and eventually it'll be impossible for him to ever pee again. That's when they told me about the perineal urethrostomy, what that surgery was like, how high of a success rate it has. Like, it has a very high success rate, but they, still told me the risks and the cons, the pros and cons, all that. There wasn't really a lot of cons, honestly. It was like either your cat is going to perish from not being able to pee, or you could extend their life for years to come, or if there's a complication during surgery, then they will unfortunately perish. But the pros far outweighed the possible con, because like he would have perished regardless. Yes, so I went through with the surgery, and now here is past me talking a little bit about that as well as I go to pick up Dipper. I'm about to pick up my poor little Dipper, who had to have surgery yesterday to have all of his male parts removed. He had 2 blockages in his urethra in the span of 3 weeks, and the vet said, you can risk him getting a 3rd blockage, but the more blockages he gets, the more potential there is that scar tissue will build up and he will not be able to pee ever, which would result in death. So I made a decision to go ahead with the surgery that theoretically should save his life and make it so he doesn't get blocked ever again, but he's going to be a cranky boy. So let's go pick him up. All right, we've got my cranky baby boy. He's already trying to escape out of his crate. We've just got a couple minutes of driving, then we'll be home, okay, baby? He's like, get me the F out of here. Oh, baby boy. Hi, Conehead. Dickless Dipper. Hi.
It's good to dip. It's like water. Water.
Oh, he's hungry? I don't know if he really knows what he wants. So we converted our theater room into Dipper's recovery room. The next 2 weeks, he has to stay mostly isolated from our other cat and definitely dog for 2 weeks while his incision site heals from his surgery. But we've got all the fixins he could possibly need. So we've got 2 of his favorite beds and lots of towels and a tarp covering as much of the carpet as possible. We've got his little litter box here with soft litter, trash can for when we have to wipe his blood clots with some cotton swabs. We can throw them straight in the trash. He's got food and water over here, and he's got a couch here with a nice pile of blankets for him to also sleep on, and then easy access up to the windowsill so he can look out the window. I think we can make his recovery as comfortable as possible in here. Oh yeah, the cone is making it so he can't lick his... Yeah, okay, good. It works. You can't lick it, buddy. I'm sorry, you can't lick it.
He's like, I'm gonna try.
Oh, I feel so bad. I can't explain to him.
Why'd you take my pinnacle? Why'd you take my pinnacle?
Hi, sweet boy.
Take my pinnacle back.
Hi, baby. Baby. Oh, baby. Oh, sweetheart. You gotta figure out how to use the litter box. Okay, I know. We gotta get rid of those walls. Hi, baby. I see you've already found the windowsill. Oh, you good? Oh, you want to come say hi? Hi, sweetheart. Oh, hi. I love you too, babes. Mad dogging me, okay. Hi, sweetie. You want some cuddles? Hi, my sweet baby. He got up here all on his own. I'm so proud of you. You want some head scritches? Oh, yeah, you got some head scritches. He literally thinks he's cleaning his paw right now. I'm sorry, baby, but you're not licking your paw. You're licking your comb. Yeah, I'm sorry. I'm sorry, but you're not licking your paw. Hi. You have a surprising amount of energy right now. A surprising amount. You're being very cute. You making biscuits? You're a little bit making biscuits. Yeah. Oh, just go baby. I was really surprised at like how much energy he still seemed to have despite having just had this surgery. Like you can see he's rolling around really happy and like affectionate. This was like the most affectionate he had ever been. Those drugs made him super affectionate, but then even after the drugs wore off, he was still very affectionate. Like, I don't know, this surgery seemed to make him like a little bit of a happier cat and not quite as spicy. So he's just kind of like a really big love bug now. One thing that I can't remember, but I do get a lot of questions about is his bowel movements and like peeing and stuff. Definitely for the first week or so, I do remember feeling like he wasn't peeing and pooping very frequently, and I was concerned about that, but I must have talked to my vet about it, and she must have not been as concerned. You know, I was taking him in every week, so she was able to monitor to make sure that nothing was getting stuck in his bowels or bladder or anything. So yeah, I don't remember specifically, but I do remember thinking, he doesn't seem to be peeing and pooping very frequently, but he was fine. Like, clearly it's over a year later now and he's still grand and dandy. But yeah, that is a question I get, is like how often his like bowel movements and urination was. And that first week to 2 weeks, it wasn't very frequent. There definitely is going to be a bit of bleeding the first like day or so. So definitely be aware of that. If it's a lot of bleeding, obviously talk to your vet. Did somebody open their recovery door? Dipper, did you break out of your recovery room? That's a no-go, baby boy. That's a no-go. Are you hungry? You look like you must be hungry. I will get you some food, but time for Dipper's morning medicine. I took some wet food. I put it on a plate because his cone makes it really hard to eat on a bowl. I have to take this pill and open it up, and this pill and open it up, and put half of each of these on here. So one pill is a pain medicine and one is a urethra relaxant, and then this pill crushed on top of that, which I don't remember what this one is. This one is, I don't remember which this one is, but this goes on top of that. No, Peppa, this is not for you. I'll get you some in a minute. And then after breakfast, he'll get a syringe of this in the mouth, which is, I think, another type of pain reliever. Bon appetit, Dipper. There you go, baby. Are you purring? You a happy boy? Yum yum breakfast. Make sure you get that pill. Put that right on top. I did add a second bigger litter box because with his cone, he was really struggling to find a good position in the smaller one. And I am really glad that I put these towels and tarp down because there are some blood spots, just little tiny leakages around. So I'm really glad it's on the tarp and not the carpet. Putting something in Dipper's mouth when he doesn't want it in his mouth. He is notorious for being a little cranky pants when you try to give him medicine. So here we go. Hi, come get some cuddles. Come get some cuddles. You want some pets? Yeah. There's my baby boy. Sweetie. Now this, thankfully, he doesn't have to swallow. It just needs to absorb into his gums. But it's just he never enjoys it. So let's give him some lovin's. And I've never done it with a cone on, so this will be even harder. Okay, that's my little baby boy. Hi, sweets. Nope. There we go. There we go. All gone. All gone. Let's see how Dipper's doing. Hi, baby. Hi, sweet boy. Yeah, you look so comfy up here. You look so comfy and so out of it. That's my good Dip. Dipper did very well in his isolation room, but he kept wanting to break out. He has always been able to open doors, like he can jump up and open door handles, but I think also Padfoot was trying to break in. It was very interesting. So I had to barricade the door for 2 weeks. I literally just put a bunch of stuff in front of the door and on both sides, really, so that neither Dipper could break out nor Padfoot could break in. There were still a couple of instances where I'd wake up and the door was open. I'm like, oh my God, you guys. But yeah, he otherwise did really well in his recovery room. We went and cuddled with him very frequently, and then I would bring him occasionally into my bed to snuggle with me. But otherwise, I didn't want him roaming the house for that first little while his incision site was recovering. Hi. Hi, you miss me? Yeah, you miss me? Hi, sweet boy. Oh. Ow, don't kick my feet. This messy boy. Hi, Dip. You want to roam a little bit deeper? No, you won't go back in your room? You were the one banging on the door. Oh, you want me to be in there with you? Oh, you want food? Okay. I'll get you some food. Dipper, I got you dinner. I got you dinner, Dipper. Come on. Come on. Yeah, Tip Tip, come on. Okay, before I show the video, for context, my cat had a perineal urethrostomy. I think I actually said that correct on the first try. A PU surgery about a year ago now, and has had no issues, no UTIs, no blocks since. But sometimes I get asked, well, I get asked lots of questions, but sometimes I get asked what the surgery site looked like during healing. And I have been hesitant to show it because it's really nasty. So this is like your forewarning. If you don't want to see what a cat's surgery site looks like post getting their wee-wee removed, then click away from this video. Please, for the love of God, click away from this video. You don't want to see what's about to happen. But if you do want to see what's about to happen, if your cat has had this surgery, then that'll be coming up. But also, always chat with your vet. If you are concerned about something, chat with your vet, ask them. I was able to take Dipper in once a week for checkups for the first few weeks. Not every cat can handle going to the vet that often. Dipper barely could handle that, but just like a heads up, always chat with your vet. Okay, now for the gross images incoming now. Okay, as you can see, it looks pretty nasty, and so that little bit that's hanging is actually a scab that I was able to get loose by putting like a warm damp washcloth over it multiple times a day for a few minutes, and it became loose and eventually fell off. But yeah, it's pretty gross and scabby and pussy and not super great. But every time I took him into the vet seemed okay with how it was looking, so I didn't worry too much. Yeah, you can see the pus there, it's coming out. Ugh, I hate looking at this, but yeah, that's kind of how his healing looked. This was about 12 days after surgery. Dipper's cone is finally off. Move out of the way, Peppa. There he is. Today's his first day without his cone. He's still so sleepy. This morning was also his last dose of pain meds and the urethral relaxant. And he got his vaccine shots today and a tapeworm shot. So he is a tired boy. Look at that cinnamon roll. Look at that cinnamon roll. But the vet said that his surgery site is healing nicely and that he's good to not wear his cone anymore and that he can lick his surgery site as long as he doesn't overlick it. But yeah, he's doing great. Every time Dipper has stayed at the vet for longer than a day, when he comes back, Padfoot doesn't recognize him and was a little, not aggressive, but a little growly. So he's better now and recognizes his brother of 5 years, Padfoot. 5 years. All right, I will stop talking in your face, Dipper. Surprise. Dipper has been cone-free for a full week now. He had to have his cone on for 2 weeks, and then last week, the vet said that his wound was looking great. Dipper's such a happy boy. He's my happy baby. He's my happy baby. Yeah, you happy boy. It's about 3 months post Dipper's perineal urethrostomy, which I think I said right. I was practicing before this video. They had to remove his dingling and make him essentially pee like a female cat instead of a male cat. So they like take the dingling out and shorten and widen the urethra opening so that these male cats that have the frequent urine blockages, makes it so they are far less likely to have urine blockages in the future because the urethra opening is shorter and wider. Anyways, so I had made a video of picking Dipper up from his vet appointment 3 months ago after his PU surgery, and I did not realize that to this day I would still be getting a lot of questions about his recovery from people whose
own cats are about to go through the same surgery. So I want to do like a quick update and like touch on some of the things that I've been asked the most for any other pet parents whose cats are about to go through the surgery and just like want some peace of mind. It is, nerve-wracking to have your pet go through such an extensive surgery, and it's a 3-week healing process, so I understand why people are asking these questions. So the main one is, how is the healing process? Really good. Like, you don't know my cat, but I was worried that he was going to be a monster healing, because he's kind of a monster normally. Like, I love him. He's a sweet guy, but he is a cranky old man without being old, He's always just been, like, on the spicy side, and poor my vet techs that have had to deal with him not on anesthesia because he's an a-hole. Like, I'm sorry. I love him, but he's an a-hole. I thought he was going to be a monster. He was great. He was phenomenal because he was on so many drugs. He was just freaking drugged out of his mind like the entire 3 weeks. So it was great. It was still hard getting him to take oral painkillers. The vet gave me one that only needed to absorb in his cheeks, and he didn't actually necessarily need to swallow it because they knew he's a little a-hole and it would have been really hard getting him to swallow anything. The painkillers and antibiotics and stuff, I gave him all of his, there was a lot of things I had to give him, but he took them, he ate them all, drank them all, whatever, and then I kept him in a room. Like, I know everyone's gonna be able to do this because not everyone's going to live in a house where they have extra bedrooms that aren't, like, in use all the time, so I understand that, but do what you can to separate your cat if they're going to go through the surgery and you have other pets in the home. So I had a room. Definitely at least the first 24 to 48 hours, you want to keep them in a room where you can either put down towels or a cloth tarp or even just somewhere with like laminate floors, because there will be a little bit of bleeding and discharge after the surgery and you don't want that staining your carpet or furniture. So I had him in a room where I was able to cover like the entire carpet with this canvas tarp and some towels, and I kept him in that room for 3 weeks because I do have another cat and a dog and like lots of areas that Dipper would jump if I didn't keep him secluded. So that worked really well for me. Everyone's situation can be a little different, but at least for the first 24 to 40 hours, there will be some bleeding and leakage, and you don't want that getting on stuff, So that went well. The other thing is how the surgery site looked. It looked disgusting. It looked horrendous. It was just awful. I don't know if everyone's cat's healing site from the surgery looks like the way Dipper's look. Another issue was Dipper also had worms at the time, so I won't go into detail. Just know it was really gross and I didn't enjoy looking at it, but I had to look at it to make sure he was doing okay. He went in every week. Not every cat's gonna be able to do this because, going to the vet is really stressful, but he was so drugged out that he didn't really notice. But I took him into the vet every week for his weekly checkup for 3 weeks, and the vet was saying that his healing was looking good, his surgery site was looking good. There was a couple instances where it's got pretty scabby, and so the vet just told me to use a warm, damp washcloth and hold it there as long as he'd let me. And make sure it's not too warm, just like slightly warm. Like, you don't want to hurt your pet. So I just got it slightly warm, held it as long as he'd let me a couple times a day, and then the scab would just fall off. Because I tried the Vaseline, wiping Vaseline on it, and that did not work very well because Dipper really didn't like that. So, find which method works best for you and your cat. But yeah, the surgery site looked really gross. Okay, like, there was one point where I was seriously concerned because it was all pussy and scabby and not looking good, and the vet's like, oh no, it's fine. I'm like, okay, I trust you. You're the one that has all the experience in this. Another question I get asked a lot is, how did he do with the cone? The cone actually stayed on all 3 weeks. He didn't get it off at all. Again, I think because he was drugged. And 2, like, they make the cones really nice. Like, I don't know, however they make them now, at least for cats, like, it's really hard for them to get it off. I will say it was hard for him to eat and drink. It was especially hard for him to drink, and I even got a water fountain. Let me show it. I got him one of these, thinking it would make it easier for him to drink, I don't think it did. I don't think it made it really that much easier for him to drink water. But this is what I got him. And plus he's used to drinking water like that, so I thought that would help. But the main way he got his liquid in for the 3 weeks was I just made sure to add liquid into his wet food when I fed him wet food every day. And that was really the main way that he got his liquid. He also doesn't like wet food. What kind of cat doesn't like wet food? So that was a whole other thing that made feeding him very difficult. Those are the main things that I get asked on my video. I'm trying to think if there's anything else that I should add. So if you have other questions besides what I addressed in this video, pop them down in the comments. I'll answer them. But I hope this helps any of you that is about to have their cat go through the... I'm not going to try to say it again. I used my one good pronunciation of it at the beginning of this video. But if you have cats that are about to go through the PU surgery, I hope this video helps ease your mind. And like, none of this is guaranteed. I will say that disclaimer, and the vet will tell you this as well, that like their surgery makes the odds for them so much better, but none of it's 100% guaranteed. But I've seen lots of success stories. I have a success story of my own, and I hope you all have your own success stories after your cat goes through this PU surgery. So I'm wishing you all and your fur babies lots of luck and sending lots of love and healing vibes and calm emotions during a very stressful time. Yeah! Come on, everybody! Come on, everybody! There he is! Donuts for Snow!